Hello, everyone. Welcome back to 3 News Now. It's Friday, December 4th. I'm Stephanie Haney. Thanks for choosing to be here for your top stories from WKYC.com and our WKYC app. We start with breaking news. Governor Mike DeWine's press conference today addressed how we will be handling dispersing a COVID-19 vaccine here in Ohio if we do, in fact, get that first distribution, assuming that those vaccines get that emergency use approval from the FDA. Here's what we know from Governor Mike DeWine as of right now. What they are calling Phase 1A of distribution will give priority to, in no particular order, healthcare workers and personnel who are involved in the care of COVID-19 patients, EMS responders, and vulnerable people who live together in close proximity and those who care for them, which, of course, we understand that to mean people who live in long-term care facilities, those nursing homes and those kinds of things, and the people that care for them. Now, the federal government has said we will not know for sure how many vaccines are coming until closer to the time for shipments, but here is what is understood right now, according to DeWine. The first shipment is expected from Pfizer here in Ohio on December 15th. That will be about 98,000 vaccines, and Governor DeWine just said that that is not 98,000 vaccines that need to be split in half because remember, this is a 2-shot vaccine. That is 98,000 vaccines that will vaccinate 98,000 people, and then a second shot will be coming in mid-January so that they can move forward with that second shot. So to be clear, 98,000 vaccines coming means 98,000 people. It doesn't mean half of that amount because it is a 2-shot vaccine. Then on December 22nd, Ohio is expecting a second shipment of about 201,000 vaccines from Moderna. These vaccines will go to 98 hospitals and 108 health departments. Those hospitals will vaccinate people dealing with COVID patients, and health departments will vaccinate people like EMS, for example. Also, on December 22nd, Ohio is expecting another shipment from Pfizer. The tentative number of vaccines in that shipment is 123,000. Those vaccines will go to Walgreens and CVS for vaccinations of people who congregate in care settings. And then a few days later, another shipment of about 148,000 vaccines from Pfizer and about 89,000 vaccines from Moderna are expected. That was a lot of numbers. We've got it all broken down on WKYC.com and the WKYC app, but that's what we know about the COVID-19 vaccine disbursement protocols as of right now, according to Governor DeWine. Now, he said in his press conference today that we're in a very dangerous situation, and he thinks everyone can agree that we can't let our hospitals get to the point where healthcare is threatened. The curfew, mask wearing, retail inspection have all helped, he says, but they haven't helped enough and we'll have to do more. Governor DeWine says, we don't have a choice, not exactly making clear what that more would look like in that moment. But with that in mind, let's turn to the latest numbers on COVID-19 here in the state of Ohio. And remember, this data is incomplete, so this isn't exactly a daily picture of what's going on, but it does give us some idea of the fact that Ohio is not going in the right direction. We can confidently say that. The number of new cases reported today is 10,114. Now, with that number, we don't know how many of those cases are from the backlog that continues to need to be tested, and we don't know how many cases are left out of that because of the backlog that continues to be tested. But what we do know is that 10,114 cases is a high number of reported cases. That's among one of the several highest numbers that we have seen reported here in Ohio. We take a look at the positive rate of tests that come back, and as of Wednesday, the daily positive rate was 15.7%. So that has come down a bit. On Monday, we had a positive rate of 18.9%. The 7-day average, though, still above 15%. That number is at 15.5% as of Wednesday, which keeps Ohio on its own travel advisory list. And in the last 24 hours, 129 new people have been reported as losing their lives related to COVID-19. Hospitalizations, how those are looking, we've seen 392 new hospitalizations in the last 24 hours. That's up a little bit from yesterday, but the total number of people in the hospital is down a bit. That number is now 5,092. And of those people in the hospital, 1,208 of them are being treated in an ICU unit. And here in Ohio, we have about 25% of our hospital beds available right now for people who need to be treated. Taking a look at the national and the global COVID-19 numbers, we have some records to report again today. which is not great news. These numbers come from Johns Hopkins University. The U.S. has ran right past 14 million cases. The number is now 14,218,080, and the U.S. is now at 277,412 deaths. Now, taking a look at how that compares to Monday, we've seen over 10,000 new COVID-19 deaths reported in the U.S. since Monday. At this rate, the U.S. will be over 300,000 COVID-19 deaths by the new year, really before Christmas at this rate. With 4% of the global population, we have 21.7% of the COVID cases and 18.3% of the reported COVID deaths. Globally, the numbers have steamrolled right past 65 million, with almost 750,000 new cases globally in the last 24 hours. That number is now at 65,583,297. And the number of deaths globally is now over 1.5 million, 1,512,846, with almost 49,000 deaths reported globally since Monday. Bringing it back locally, Cuyahoga County is seeing an all-time high for its 7-day average positive rate for COVID-19 tests. It's almost at 25% over the 7-day period running from November 22nd to November 28th. So that's last week. To give you a little bit of context there, the first week of November, the positive rate was 14.9%. So quite the increase in just a couple of weeks. The restaurant industry has been hit very hard by COVID-19. That's something that everybody knows. While in Cuyahoga County, County Executive Armin Budish announced today a $1.2 million grant program to help restaurants in the Cuyahoga County area. This money is coming from U.S. CARES Act funding. So this isn't new allocated money. This is money that's now being put to use from the U.S. CARES Act. And restaurants will be able to apply for grants of up to $10,000. Those applications will be accepted through 5 p.m. on December 11th. So that's 1 week from now, next Friday. And the money will be distributed by the end of the year, by December 31st. Money is definitely a touchy subject when it comes to COVID-19, and many people have been hoping for relief from Congress. That doesn't look like that's happening in the form of a direct check, but a former presidential candidate has a plan for getting people skeptical of the COVID-19 vaccine to get the shot. He's suggesting that the government pay them $1,500. This is former U.S. Representative John Delaney, a Democrat out of Maryland. Delaney says that the faster we get 75% of this country vaccinated, the faster we end COVID, and the sooner everything returns to normal. That's that herd immunity concept, which leading infectious disease experts have talked about, hoping that the vaccine gets us to that point without seeing the casualties that would come from a natural occurring herd immunity situation. Now, based on a Gallup poll that came out on November 17th, 42% of Americans say they would not agree to get a vaccine that was approved by the FDA for COVID. A major concern that was raised was the rushed timeline for this coming out. Others said they wanted to wait and make sure it was safe or effective before taking it, and 12% said they just don't trust vaccines in general. Now, this is an interesting idea coming from the former candidate and former representative when the odds of getting another direct payment from Congress not looking so great. Right now, moderate senators are talking about a $908 billion stimulus package. This would be a compromise package, and in that package, there would be that $300 per week jobless benefit from the federal government in addition to state unemployment benefits. Also, money for state and local governments to boost schools and universities, and that popular Paycheck Protection Program, which helps small businesses keep people on their payrolls. Also, a bailout for transit systems and airlines, but no money for direct stimulus checks, which is something that House Democrats have really wanted and has been a bit of a sticking point in coming to terms with legislation. We have updated guidance as well from the American Academy of Pediatrics when it comes to what student athletes should be doing at the lower levels. And now AAP is recommending that children wear masks for most youth sports, even when they are not just on the sidelines and during less intense sports. So the previous guidelines were that the athletes should wear the masks on the sidelines and during less intense sports, but now AAP is saying during most sports, especially indoor sports like hockey, where there's a greater risk of spreading COVID-19. AAP, though, does say that there are certain sports where face masks would be a hazard. They shouldn't be worn during competitive cheerleading, gymnastics, wrestling, swimming, and diving. Those last ones there for obvious reasons. Your mask is going to get wet, and that's not going to be a great safety situation. The AAP also said that athletes should immediately change those face coverings if they get wet with sweat. Speaking of sports, the Cleveland Browns have taken defensive end Joe Jackson and linebacker Sione Takitaki off the COVID reserve list. They have been cleared to play. Earlier this week, defensive end Myles Garrett was also cleared to play after being placed on the COVID list. So that means the Browns defense will be a lot more whole going into a very important game. The 8-3 Browns take on the 8-3 Tennessee Titans on Sunday at 1 p.m. And yes, this does have playoff implications. Now for a big story out of Congress. House representatives have voted to decriminalize marijuana at the federal level and to tax marijuana at the federal level. That's key. Also, notice I said decriminalize, not legalize. There is a difference. To legalize marijuana would make it equal to things like tobacco and alcohol, and to decriminalize marijuana removes criminal penalties, but it stops short of making it available to adults on such a broad scale. But what the bill would do is take cannabis off the list of federally controlled substances. Now, the people who support this say that this would reverse a failed policy of criminalizing cannabis use, and they call it a step to address racial disparities in enforcement of federal drug laws. The bill would allow states to set their own rules on cannabis, which they've already been doing. Most Americans live in states where marijuana is legal in some form, including here in Ohio, where it's legal for medicinal purposes. Right next door in Michigan, it's legal for both recreational and medicinal purposes. And experts agree that nationally, the cannabis policy is way behind the states, and this has led to many problems, including in the area of loans and banking, because it's hard for these marijuana companies to get loans and to get traditional banking services because cannabis is illegal at the federal level, and many banks are federally backed. Now, a related bill that would have given access to traditional banking services for these companies has been sitting in the Senate, by the way, after being approved by the House last year. So keep that in mind. We'll talk more on that in just a second. But you might be wondering, where would the tax money go if this bill were to become a law? Well, it would go towards the needs of people in places that have been harmed by the so-called war on drugs, and also toward resources to expunge federal marijuana convictions and arrests. This is a huge move, obviously, but it is definitely not enough on its own. People who don't support the bill are calling this completely symbolic and criticizing the people who have put forward the bill because of many other issues that are happening right now. However, House Democrats in support of it say that they can do two things at one time. In any case, this is only a step. Any bill would have to pass the Senate. And with Democratic Senator Mark Kelly just sworn in Arizona, the Senate is still in control of Republicans, 52-48. But all eyes now remain on Georgia. That January 5th runoff could potentially have implications for the balance of power in the Senate, because there are 2 Senate seats up for grabs currently held by Republicans. So right now, the Senate in the new year sits at 50-48 with those 2 seats for those Georgia senators up for grabs. So all eyes definitely on that contest. One more thing to tell you before we go here. Bridgestone Fire announced today that they are refurbishing and relocating the company's historic Firestone sign. This is in Akron. Right now, the sign is on the Firestone Plant 1 building on Firestone Parkway. That's where the company makes its race car tires for the NTT IndyCar Series. That's where they make them right now. That is all moving up the road very soon to a brand new facility that will fully open in 2022. But refurbishing that iconic Firestone sign will not take that long. They say it'll take several months, but they're not sure where the sign will go yet. And Bridgestone said they'll announce that later. But they are wasting no time getting started on this project. The project starts on Saturday, so you can expect to see that happening in the Akron area beginning on Saturday and over the next several months. That's it for your 3 News Now update for Friday, December 4th. I'll see you next up on What's New with your trending stories in the Clicking in Cleveland segment. And tomorrow, we have a new episode of 3 Things to Know with Stephanie Haney. You can find that podcast on your favorite podcast platforms. You can also see me very, very early tomorrow in the Go Morning Show. Bright and early, we are talking about loneliness in the pandemic. And I have a Cleveland Clinic psychologist, Dr. Adam Borland, giving me all the tips that we all need to know about all of our relationships right now, whether that's with family, friends, coworkers, lovers, you name it. And there'll be a little preview of that tomorrow in the Go Morning Show, but make sure you subscribe so that you can catch that podcast as soon as it drops early tomorrow morning. Everyone, enjoy your weekend, stay safe, and be well. I'm Stephanie Haney.